so many familiar faces. I had no idea that I would. That's really lovely. And what a fun talk. Usually I get to speak with medical students or nursing students about specifically naturopathic medicine, but this is more about the philosophy of integrative medicine in general, which is just so much more creative and open with so much more potential and really a learning process. So let's make it a fun group atmosphere and shared experiences. And I'm curious, of the people here, who's somewhat familiar with integrative medicine or naturopathic medicine? Kathy, hi. A little bit. Yeah, great. And is there anybody who considers themselves to be entirely inexperienced or maybe even skeptical, or?
Maybe you need to give us a definition.
Okay, well, yeah, we'll definitely get into that. But it's just nice to know where people are coming from. What about healthcare backgrounds? Anybody here with a healthcare background? No? All right, so let's move on with it. Really briefly then, I'm a naturopathic doctor, and I started Kingston Integrative Healthcare about almost 5 years ago now, after being in practice for a couple of years myself. We're a team of 10 healthcare practitioners. And big picture, what we try to do is combine the strengths of many different kinds of medicine, or the idea of integrative medicine being taking the strengths of a whole bunch of different kinds of medicines, which minimizes the weaknesses, integrative medicine including the mainstream medicine, and see what potential we can achieve for health. We try to address the underlying cause of illness, look at the big picture, encourage patients to explore beliefs about health, match them with a team of qualified health professionals, and educate people about their options and respect their choices. Sounds really idyllic, and if you understand a little bit about the philosophy of integrative medicine, not as idyllic as it might sound, so let's get into that. Now here's a big picture overview, and we'll bring it right down to something more practical. If mainstream medicine, which is also called allopathic medicine, is considered the medicine that is primarily North American, something that we developed over the last less than 100 years, and all the other medicines complementary alternative are everything non-mainstream, then you end up with the idea of integrative medicine, which is defined many different ways and still a developing concept. It's maybe a little bit more popular in the United States, in North America, but the idea that at least we're combining other kinds of medicines with mainstream medicine, but I'd like to think of it a little bit more broadly to also include the whole body, the whole person and their environment, their social experience, their biography, all of these pieces, and taking the best of all the different kinds of worlds, which include Chinese medicine and Japanese medicines and Ayurvedic medicine, which is Southeastern Asian type medicine, and homeopathy, and all these other kinds that we can discuss very briefly as we go forward. And a lot of the premise of the work that I do, a lot of naturopathic doctors, a lot of people who practice integrative medicine, including medical doctors, even here in town, who try to integrate a lot of different concepts into their work. So based on a lot of this idea here, which is that mainstream medicine, which used to provide everything we needed, theoretically, for decades forward, 50s, 60s, 70s, 80s, is slowly progressing to a place where it cannot manage the healthcare needs of our population any longer. A large part of this is the advent of chronic disease, which is heart disease and diabetes and depression and all of these things that are not acute concerns. It's about the environmental toxicity that we have now. We didn't have this severe toxicity a few years ago when mainstream medicine really, where it started. And individual empowerment, if you will, or the idea that people are looking a little bit more clearly at their choices, trying to develop their own philosophy of healthcare. What is it that they need, and find a match. And that's what I want to do a little bit of today, explore what your individual healthcare philosophy is, what your healthcare needs are, and find the kinds of healthcare practitioners that you require for feeling well, not just preventing disease. You know, some interesting statistics. Well, even chronic disease. Let's go back to chronic disease. So mainstream medicine is a patriarchal system that included the idea that the physician was your source of information, and you did what the physician recommended. And I see a lot of women in their 70s and 80s, and they're very afraid to decline options provided by their family physician, or afraid that their physician is going to fire them as a patient, which does happen sometimes. And it's lacks respect for patient choices in some ways. And we've moved into a paradigm where people are looking for more options, and with chronic disease, you think about 45% of Ontario's budget is dedicated to our healthcare system, and we expect that 80 years we're going to need 80%, and most of that is for chronic disease management. And so let's look at chronic disease, and that's where integrated medicine really supports how the body functions optimally. All right. Any questions about this broad overview so far? We're going to get into much more deeply with, let's define your own healthcare philosophy and what you need, and let's explore the philosophies of other medicines and find a match. Okay? Really quickly, Kingston Integrated Healthcare, what I do, we have 3 naturopathic doctors, a couple of massage therapists, 2 osteopaths, a psychotherapist, an energy worker, a neurofeedback practitioner, and we try to offer a lot of community resources, meditation, qigong classes, Reiki courses, lots of other pieces, an information resource center for individuals looking for some good reading material, for example, about their health. There's some photos of what our clinic looks like. And a little bit about me, so that you know what kind of people that I work with. Naturopathic doctors have been regulated in Ontario for over 85 years. We go to school for about 8 years. I did my undergrad at Queen's in biology, and another 4-year degree in Toronto. There are only 2 schools in Canada eligible to grant the designation of naturopathic doctor. And following that, we write a couple of sets of board exams, Ontario licensing exams. We require continuing education credits to maintain our license. We have 7 of 8 controlled acts in Ontario, which means that we can do a lot of the same things that your family doctor can. We can order laboratory work, we do physical exams, we can do injections or intravenous therapy, that kind of thing. Our scope of practice, it includes medical nutrition, or nutrition that actually supports how the body functions beyond what Health Canada might suggest, or beyond what a dietitian might do. It's not just about, for example, if you have diabetes, here's a diabetic diet. If you have high cholesterol, here's a diet for high cholesterol. It's about looking at the whole picture and figuring out what kind of nutrition does your body need in particular, where is it deficient, where is it in excess, what will improve the function of your body. Natural health products, which are supplements, a lot of the things carried at health food stores. We do a lot of that to support how the body functions. Acupuncture, Chinese medicine, botanicals, which are herbs, chiropractic type things, functional medicines, and homeopathy. So I'm happy to go into that a little bit more afterward if anybody's curious about that broad scope. But what it means is that I function like a family doctor of all these other kinds of medicines, and it's about taking the best of all the different kinds of medicines for a particular person. Some people are, their bodies match a Chinese medicine paradigm extremely well, and a Chinese medicine doctor would work really well to help their body heal. Compared to some people, it's more about the nutrition and getting those basics in line. And the potential, if we can take all of this knowledge inherent in so many different kinds of medicines and put it together for one person, is incredible.
Can I ask a quick, it's a silly question, but it was 7 out of 8, which one is not that you
Oh, well, that gets complicated. So part of it was prescribing pharmaceuticals, but legislation just changed, so now we have prescribing rights. So it's within our scope of practice now to prescribe pharmaceuticals, but they haven't decided yet which ones. And so in the very least, it probably means at least those natural health products that were taken off the store shelves, according to Health Canada guidelines,